Welcome to the Gyne Talks Podcast. Myself and guests will be sharing our experiences and journeys, talking all things gynecology related. Now, there is a trigger warning here that we will be talking about some very sensitive subjects. However, I really hope that you enjoy this episode. Hello there and welcome to the Gyne Talks Podcast. Today we are speaking with Professor Radwan. He is based between the UK and Qatar. He is a gynecologist and specialist in that field, so I'm really excited to speak with him today. Hi there, Professor Radwan. Thank you for joining me.
Hi, hello Jessie. It's a pleasure being with you today and to talk about the issues you're going to talk about, I'm very excited about that. Yeah.
Of course, thank you. So obviously with Gyne Talks, we have a platform where we talk about all different gyne related issues, anything from endometriosis to fertility through to menopause. So I understand you have, a good experience over the years. And again, like we say, working in 2 different countries. So tell us a little bit about your journey in this sector.
Okay, my journey started a while ago, really, over 25 years ago.
Wow, okay.
Yeah.
And I'm sure things have changed a lot in those 25 years.
Yes, absolutely. I started back first of all, from Iraq, my medical degree.
Okay.
And I went to Jordan. I did higher specialization in obs and gynae, junior doctor, and then I got my higher training there. Then I started in a big hospital, mainly focusing on reproductive medicine. So we see couples trying to conceive, helping them with their journey of fertility, and same all with managing with women with pelvic pain, all gynecological conditions like heavy periods, endometriosis, previous surgery. And I did also help these women to have their dream baby, also to deliver them with and look after them during pregnancy, antenatal care,
amazing.
and cesarean section or normal delivery.
Wow, so really you kind of have done everything.
Yeah, from A to Z.
A to
Absolutely.
Z, yeah.
Yeah, and following that, I went to Oman in the Gulf region, and we started the first IVF center back in Muscat, and we were pleased to have the first IVF baby in that country.
Oh, amazing.
So that was a nice achievement from our center. And then I went to the UK, and that was in 2002, and I continued my training till become a consultant in Yorkshire, in South Yorkshire, Rotherham Hospital.
Okay, so that's a little bit different to the countries that you've been in.
Yes, absolutely.
The weather is definitely different.
Oh, yes, definitely. Wherever I go, I love my work. I am passionate about my service to my couples, women and men, and that's really all about enjoying what you are doing, really, and helping people, and it will be rewarded really at the end.
And I'm sure it is really rewarding. I know I myself went abroad to have ICSI treatment, so the IVF fertility treatment. We decided that when I was 25, coming to 26, and I was told that I could go on the waiting list in the UK for fertility treatment, but I would need to wait until I was 30.
Okay.
And at that point, I'd already had 5 operations to remove endometriosis. So there was a lot of scar tissue, and obviously it kept reoccurring. So we started looking into different options, and we ended up going to Turkey, to Istanbul, to have our treatment. Okay. Yeah. And my son now is 11. He'll be 12 this year.
Right.
So again, I'm sure things have changed dramatically in the research and the services and the procedures in that time. How do you find the difference between working in countries abroad to the UK? I know when we had our treatment that in Turkey at that point, they were able to zoom in 10 times more on the sperm, and the procedures were a lot more not invasive, I don't think that's the right word, but it was a lot more pinpointed than it was in the UK.
Yeah.
So how do you find the difference between maybe the
Yes.
technology and the services that you're able to offer between the two between multiple countries?
Yes. To be honest, starting from the couple themselves, couples who are infertile or unfertile, wherever they are, the pain is the same,
Yeah,
the stress is the same, the anxiety is the same, really. Now we talk about the regulations. Some countries are heavily regulated with the
yeah.
rules, and that's mainly related to the budgeting for the IVF or the advanced fertility service. So in the UK, we have the eligibility criteria for
Yeah.
couples to be eligible for NHS funding for IVF. Other countries, they're more open about this. So they do offer for all people IVF free, especially the local people. Currently, I am in Qatar, and it is almost free.
Oh,
The
wow,
issues with
okay.
free for local people, and expats pay nominal fees. Really, it's not that expensive as well. But the issue is with the pressure and the waiting list, as you know. In the
Mm.
UK, we did have a long waiting list, and then gradually, when the NHS started to commission their patients to independent providers like care or other units,
Yeah,
the waiting lists start to drop down a little bit. So this is from the organization and the funding. In terms of regulations of that, again, different countries have different rules.
yeah, of course.
So a number of embryo transfer. Most Western countries are aiming to transfer one embryo. The aim is to reduce the rate of multiple pregnancy.
And the risk that
So
comes with that, of course.
absolutely, couple they don't appreciate that. They come asking for twins. We want to have twins. We want to have a
Put as
triplet.
many back in as possible.
Exactly.
Put 5 back in, see if it works.
Yes, I don't mind, but my colleague, the obstetrician, will come carrying the stick for me because you made them pregnant one. So that's another issue. Is we are heavily regulated by number of embryos to be transferred, depending
Yeah,
on the prognosis of the woman. If she is young or their 40s, you transfer two embryos. The younger woman transfer single embryo. Other issues is something like what we call it, and that will follow about what we call it selective fetal reduction. If they
okay.
are conceived with a 3 or 4 triplet, quadruplet, whether we can do reduce 1 or 2 embryos to make the chance for other embryos to survive. That also
Absolutely.
some countries allow, some countries not allowed. Now the biggest difference is based on donation of the gametes, which is obviously is forbidden, not allowed in mainly Muslim countries,
Okay.
and that including the sperm donor and the egg donor. This is more likely to available in the Western countries.
Yeah.
You can help a couple who have what we call it azoospermia, in which they have no sperms, and the couple who
Okay.
have and women who have ovarian insufficiency. We used to call it ovarian failure, and we shouldn't call it ovarian failure. It's ovarian insufficiency now. Well, so many, Jesse, different in different countries. Really, to be honest with you,
Yeah, of
that's what comes to
course.
my mind.
It's
Yeah,
it's really interesting to know the different rules and regulations. And as you say,
yeah,
obviously with Muslim countries there are other factors to pull into that. Do you find a lot of UK kind of citizens or residents, like myself, traveling abroad to the countries that you've worked in to have their treatment?
yes, they do. And again, all about what we call the strict eligibility criteria.
Yes.
Being strict mean it's not really open for everybody, unfortunately.
No, of course.
So the strict mainly is about age and having children before, and the BMI, which is the body weight.
Of course. And I'm sure it
The
also, obviously, everything will also factor into the condition or the illness that either the woman or male have, or both. If it's a combination that,
yes,
there's a couple where the sperm isn't working so well and the ovaries or endometriosis has effect, that also can be, obviously a
absolutely. I
deciding
mean,
factor, I'm sure.
One of them is having a child in the family. I mean, if the woman have her partner have a child from different relationships, she said, okay, I don't have my own child, and that will be an exclusion for the eligibility criteria at the moment for the NHS. And
Because they already have a
they
child
have a child,
within the
even he
family.
has,
Yeah.
even if you have a 10 or a 15 years old daughter from previous marriage or whatever, so they are not eligible. So these are the things that people feel the pain about it, and they feel the anxiety, and that's why they seek treatment abroad, or they go to private sector
Yeah,
in the UK as
absolutely.
well. Yeah.
So we went to private sector in the UK,
Hmm.
and ran some tests there, and we had, a few surprises on those tests that
Mm.
would mean we would need ICSI rather than kind of IVF. So obviously with
Yes.
ICSI, it's removing of the egg and the sperm, and just for the listeners, to create the embryo outside of the womb and obviously put those back in. So I actually had 2 embryos put back in, and
Great.
I carried both till around 6-7 weeks, and
Mm.
then lost the one embryo, and obviously
Oh,
was
really?
full term with my son.
Right.
And again, like you say, the anxiety and the stress and the worry, even leading up to it and the years prior. So with the endometriosis, I was diagnosed at the age of 18. And like I
Mm.
said, I had 5 operations prior to going to have the treatment,
Oh.
the IVF treatment. And so I was 25 when that happened. By the time I
Mm.
was 30, of 31, I'd had 10 operations because the
Wow.
endometriosis kept returning.
Progressive. Yeah. Yeah.
Absolutely. So it's been progressive, and I still suffer now. But what I've had for the last 3 years is being induced into a medical menopause. So I
Mm.
have the Prostap injection
Okay.
every 4 weeks to
For how long you been using Prostap, Jessie?
for
How long?
3 years now.
Really?
For 3 years,
All right.
and have the HRT to go alongside that daily,
Mm.
to kind of help the menopause symptoms, which is
Mm.
a whole
Yeah.
different scenario
Yeah.
altogether.
Yeah.
The hot sweats, the flushes, the feeling down, and I find my mood has been very up and down with that, and it's just finding that balance, isn't it? I guess that's
Yes.
the next stage, and it's
Definitely.
going through all of these things can be very, hard on your mental health for sure. I know that
Mm.
when, even going back to when I was 18 and being told that I had endometriosis, I knew for years prior there was something
Mm.
just not right. And
Yes.
the
Yes.
doctors at that point, oh, it's just, teenage years, a heavy
Painful
period.
periods, however,
Yeah,
heavy period, yeah, pain is normal.
absolutely.
Take
Uh,
Constant or paracetamol, whatever.
yeah,
That's the
definitely.
problem. Delay in the diagnosis, most of the
Delaying the
women.
diagnosis,
Yeah,
definitely.
yeah,
So
definitely.
I've come through all of those scenarios
Bless
now.
you. Yeah,
And
I had,
now with the medical menopause, I'm waiting currently to go back and see the specialist. So
yes.
my gynecologist, unfortunately, my gynecologist has been off and on sick or leave for over a year. So I haven't
Oh,
seen him for a year, or
really? That's
just
a long
over a
time.
year. So
Yeah.
I'm trying, I'm pushing often to see a new one, because, things as much as the Prostap is helping, that mimics kind of the menopause and helps
Mm.
with the pain. It doesn't take it away fully,
No,
and also
no.
comes with a lot of other
Yeah.
situations where the Prostap makes me feel very tired. It makes me, low mood sometimes. So it's navigating those new situations that are happening with your body. You think, oh, maybe this is going to be a full helping hand, and
Mm.
it's definitely helped. It's definitely
Mm.
reduced the pain. It's definitely helped from that point of view. But I think now I'm at the stage where we know that is working, because it's helping. So maybe now it's time to push for a hysterectomy, but without going back and speaking to the consultant and having a sit down chat with them and saying, okay, I've made my peace with that. I'll be
Yes.
38 this year. I already have a son. I'm, over the moon that all of that process worked.
Absolutely.
And I have, a wonderful son that tests me at times. He's 11, coming 12, as you imagine, coming into his teenage years. But from my personal kind of point of view, my body, I need to look after myself. And I think that's going to now be the next scenario for myself. So that's a whole whirlwind that I have to deal with. But, with what you do and in working in different countries and helping these couples, the mental health side of things is very poignant, isn't it?
Absolutely.
I'm sure you see a lot of couples that have been through, multiple maybe miscarriages, or they've been trying for a long, long time. And you get to the stage where you're also thinking, why me, or why us? Yes. You see friends and family and maybe colleagues or old school friends in the street, or, when you're out shopping and they have, beautiful children, and you're thinking, why is it my body that's not working properly?
Absolutely. I would agree completely with you about the Jessie. Mental health for women and men, obviously, suffering from fertility or childlessness is very, very important and completely underestimated, really. So the role here of the doctor, each unit of fertility, we have a counseling team who talk to women and give them time, because obviously in the clinical setting, doctors don't have a lot of time. So we have another healthcare professionals. However, it is not an excuse for us as doctors not to be compassionate. We feel for our patients. We ease their pain and sorrow when they have problem. That will affect us also. When I go home, same day, my wife tell me, you must have a good news today, because it shows on me. Or the other day, I will be upset. I can feel that I have a couple who have a problem, really. So in terms of this communication, also the health sector need to improve. And miscarriage, I tell my woman, I want you to get pregnant while you're in the best condition and the best time.
Absolutely, yeah.
Because losing a baby in miscarriage sometimes is more painful than the fertility itself or an infertility. So that's why we try to educate couple and give them information about how to prepare for a pregnancy and the preconception period. If you're kind of overweight, try to control your weight. If you have health condition, control it before you come and visit the gynecologist, because all these make the subtle difference. What could
absolutely
be
they're
translated to a major issue.
All factors that kind of go into that. And the hard thing is, and one of the main reasons that I'm have started the podcast, is to have that information out there. When we went over to have our treatment, I didn't have anybody to talk to. I didn't know how I was going to feel, what the day-to-day of the treatment was going to be. So
absolutely,
obviously, initially when we arrived, we met with the consultants, and we had a great service and amazing treatment plan there. But I didn't know what was going to happen, how my body was going to feel, on day 2 or 3 of having the injections and the blood tests and everything like that, and all of the scans and the internal scans. Yes, I'd had previous scans before, but this is back to back daily. You're having the internal scans and things. And I think it was by about day 9 or 10 of that fertility journey that we were walking back from the hospital. We had an apartment we were staying in, and I was just, I can't walk anymore. I feel so full. My ovaries and all of that pelvic area of my back was aching.
And what's happening? Nobody explained to you what do you expect. That's the issue. Now what I do, I tell you what I do now, Jessie, in Qatar, where I work in the private sector. Now I see the couple in the first consultation, obviously, probably at least 40 minutes of discussion, explanation with my audio visual. I have my website there. I have paperwork with me to show them full discussion about everything. And then when we ask for the result, now we said about technology. Now we communicate with our couple with WhatsApp. I send them voice messages about the result, explain to them, call them. They text me anytime. They're taking
Okay.
lots of our time,
Yeah.
our private time, but I accept that. I appreciate this. And we respond to them straight away with their result, with their FSH, LH, thyroid hormones. Explain to them what to do. Prescription will be ready. Send it to them within hours. Semen analysis. Men also are very anxious as women with the result of
Absolutely.
sperm count. So I ring them
Absolutely.
myself, explain to them what it is, what do they need. So all these things, minor things, make a lot of difference, really. And
Absolutely. And like I said,
yeah,
there are a lot of things that you don't necessarily understand because,
yes,
we have doctor language and sometimes you need to have that made
jargon. We
simple.
call it
Yeah,
medical jargon.
absolutely. The
Yeah,
jargon. And you're
yeah,
thinking, oh, I don't know what that means, but you're nervous and you're anxious and you may be told it's, what it means, but you walk out of the clinic and your head is just full of
yeah.
information.
So if I tell my woman, oh, I did your hysteroscopy today, I looked inside the womb and I found synechiae inside your uterus. Do you know what does that mean?
No, absolutely.
I saw
I
a
need
doctor
it
explaining.
simplified.
So I explained that means a little bit of scar tissue inside your womb. We have a look and we divided the scar tissue and we put something inside to prevent this coming back again, blah, blah,
Yeah,
blah. These minor things. Otherwise, and also we have
absolutely.
another issue is interpretation services also is important. We have so many non-local people from different countries. Here in
Yes.
Qatar, I see women from all over the world, Indian, Filipino, Asian, French, all over the world, different Nigerian, different languages,
Yeah, of course.
and try to cater for that, for this really services, which is important. The patient does not understand what his doctor or nurse saying.
Yeah, it's
Teaching for injections, how to give the injections, all these things are very, very important, to be honest.
absolutely. Obviously,
Yeah,
it's a really important part of that fertility journey, and to be able to go somewhere. I mean, we were very like we had a great interpreter. She was fantastic. She
yeah,
met us at the stairs of the hospital when we first arrived and showed us all around and just made us feel really comfortable. That
yes,
tried to help our anxiety, and especially you touched upon and we touched upon. It's very heavily focused on the woman, obviously, because it's
mm,
her that's going through all of the treatment as such. The male doesn't get the same
heavily
maybe
involved.
attention.
Yes,
Yeah, and no, not as heavily involved, but the anxiousness and the
yeah,
worry for themselves, but also for the care of their partner. And as we all know, men do not speak so much about their mental health and what's going on inside. So
yeah,
again, this is what's important for us to share and talk about and make it more acceptable or more open for men to feel accepted and to be able to talk about these things. It's not
yeah.
something maybe when, men are at the pub maybe, or they're out playing golf with their friends, that they, oh, by the way, we're going to talk about fertility today or a low sperm count. It's just
Hmm.
not something that really is spoken about. And that's what
Yes,
I want to help encourage, is that there are many people in the world that are going through exactly the same. And it's not a
absolutely.
shameful thing to talk about or to discuss with others, because you just never know. You may be in a group of 20, 30 people, and actually half of those are going through issues or conditions, especially say with the women with endometriosis or ovary problems, or like you say, lots of different situations.
Hmm.
And with the male side of things, you don't really know that there's an issue until you start going through this process. And that can become
Absolutely,
a massive shock to them, because they think, oh
absolutely.
no, I'm fine, everything's fine,
Mm.
until, like you say, you start having the sperm samples, and that's then when you start to have to explain, there may be issues.
Talking about men, the most important thing that is, men think if they are having normal sex life, that means the sperm is fine,
Yeah.
which is absolutely wrong. There's no correlation between having a normal life with your partner, with your wife, normal marital life or sex life or whatever, and the actual number of your sperm count and the actual motility or whatever, or morphology or the shape. They are completely different things. So men can have a normal life
Yes.
and energy, but they have no sperm at all and they ejaculate. So as you said,
Absolutely. And that,
they have to physically actually test it that if they have a problem. And this is the education and the awareness. Now, same thing, talk about women, about the fertility potential in the future to carry a baby. I mean, if you don't test for your ovarian reserve, how come you know you have a low egg reserve? Like what we call it, the AMH level or the FSH level.
yeah,
And if you don't physically test them and check that you have average or normal egg reserve, you will be surprised and disappointed when you are mid-30s or late 30s trying to conceive and say, oh, you have very low egg reserve. So
absolutely.
these are the minor things. Abnormal regular periods, when you miss your period every 3-4 months. This is not normal, really, to see somebody and to check it over.
Absolutely. And that's the thing. I think also with periods, you think, oh, one is maybe just a little bit late this month, or
Yeah.
maybe there's different factors in that you've been more stressed. Oh, I've been more stressed this month. Maybe that's why it's delayed. But there could be other situations that are actually causing that. And it's
Absolutely.
always worth going to the doctor and having that conversation, because you just
Yes.
don't know. It's
Yeah.
not like, for example, I broke my wrist a couple of years ago, and when I had plaster cast and a sling, I had so many people, if I was, oh, are you okay? Do you need help? Is there anything I can do for you? But for all the years with endometriosis and the situations and, surgeries, etc., that I've been through, because it's a condition that you cannot physically see, people are not aware. And that's the same with being in the workplace. So I worked for quite a big insurance company when I was going through, a lot of my surgeries and my fertility treatment. And again, because, you have to take a lot of time off work when you're, endometriosis is flaring up and you're not feeling well and you're in that much pain, you can't get out of bed. For a corporate company, it's, oh, Jess is off work again. She's off sick. But they don't understand the full kind of reasoning behind that. And it's a sensitive conversation to be having, and obviously personal, that you're trying to sit down with maybe the HR department and explain all of this.
So in your company, let's say if you have 100 women, they need to know probably at least 10 of them have endometriosis.
Absolutely.
10
and
to 15 out of these 100 women, they could have endometriosis. Out of these women who have pelvic pain, 50 or 60% of them could have endometriosis. So it's not uncommon, this problem, and people need to be aware of it and to diagnose it on time. And yes, it's fine to try painkiller at the start. It's absolutely normal to try. But once you have the problem carry on and on and on and on, you need to do something about it, really, and need to appreciate the physical part and the emotional part and the family part of endometriosis. You just said you have, I don't know, 6 or 7 operations for it.
10 operations.
10 operations. You see, this is a big number, really. So I'm not sure whether I cannot comment. But again, having operations for endometriosis, it can be done by a general gynecologist, okay?
Yeah.
And there are gynecologists with a special training in endometriosis. So your aim is to be operated by people who have interest in endometriosis. And there are excellent centers for endometriosis, center of excellence or endometriosis centers in the UK. They go for the complicated cases, or what we call it deep endometriosis. So endometriosis can be just superficial on the ovaries or whatever, or it could be involving the bowel, involving the ureter. And these the one need to be treated aggressively by endometriosis surgeons or gynecologists.
Absolutely. And it needs to be maybe for me, I need to see somebody, obviously
But
more
your case
specialist.
is not straightforward, it seems. 10
Absolutely not
operations.
straightforward. I
So
know.
please see somebody who is endometriosis specialist. And as you said, you have taken a prostate for a good period of time. So it's
Yeah.
time to think about alternative, which could be the surgery.
Yes.
And surgery, if you are happy with if your family no more, I would agree with hysterectomy and or removal of the ovaries as well, because endometriosis is depending on the ovaries. If the ovaries are still
Absolutely.
there,
Yeah.
the disease will carry on. You
And
may
that's
remove 60, 70% of it, but the pain may persist because there is too little ovaries. They keep you have the same vicious circle again and again and again.
absolutely. And it feels absolutely like that vicious circle. I was going through, I would have an operation and maybe for 6 to 8 months,
Yeah,
okay, I'm feeling better. I can do more things. I have more energy. And then it would just creep back in and I'd be like, oh, I know that pain.
no,
I know
no,
exactly what that is. And it was just a vicious cycle of
yeah,
starting to feel better and then wait to go back to the gynecologist again and be like, no, it's back again. I know my body. And now at the moment, the last 2 or 3 months, I've noticed, as you mentioned, with pelvic pain, my lower back, at the bottom of my lower back, that's
yeah,
all started again. And I'm
yeah,
just like, please, somebody help
yeah.
me. Just take it out. Now ready. Just take it all out. And then, because it's the quality of life as well, isn't it? It's
Absolutely.
absolutely about
It's all
that.
about quality of life. Endometriosis is, I wouldn't exaggerate if I would say it could be something like tumor or even, I wouldn't say cancer, but it's disease is chronic condition. We
Yeah.
call it relapse and remission, up and down. It will go back, come again. But as we said, if we remove the ovaries, that's it. Hopefully, it will be sorted. And the HRT, you're already on the HRT, so nothing new
Yes.
for you anyhow. You
Yeah.
started
The
the HRT,
HRT I
you keep
started.
going. You put
Yeah.
your patch or whatever, and you keep
Oh,
going.
so I have the tablet and the gel is what I have. So
Yes,
daily I have the HRT, and I
yeah,
think that must be making a difference. And
yeah,
recently I've had my DEXA scan, which is
yes.
the bone scan. Again for the listeners. So I've had 2 of those within the last 3 years to make sure that
Good bones?
good bones. I had my results
Okay, good.
last week. It's okay. Although not my
Okay.
good wrist after I broke
Uh,
it. But yeah,
yeah.
the DEXA scan is a scan that you should have every kind of 2 years if you're having the prostate, because that can cause issues with your bones. So
More important, you're taking the HRT to prevent the osteoporosis.
yes, so osteoporosis
So,
actually runs in my family,
okay.
on my grandmother's side. So it's very important to make
The
sure that,
estrogen, yeah.
yeah,
You take the
estrogen, and
estrogen.
to prevent, or to prolong that situation and prevent it. So it's just difficult in lots of different ways. And sometimes you feel, okay, everything is, going to be okay now. But for the families and the couples that are at that stage of,
Yeah.
they really want to move forward and have a family, it's amazing that the work that you do, obviously, in the different countries, and how you're helping women all over the world and families, husbands and wives or couples. Do you treat a lot of same-sex couples
In the
at all?
UK, in the UK, obviously, even the regulation has changed now, and
Okay.
couple same sex are eligible for NHS funding. It used to be with certain criteria, obviously.
Yeah, of course.
So they are referred to our IVF unit, assisted conception unit, either for donor insemination or for IVF. So yeah, they are not excluded the last maybe 5 or 6 years. So the
And
funding is available.
that's a great improvement from, the way that things move on, isn't it? Because years ago
Mm,
that would just not be an option for
yeah,
same-sex couples. And
yeah.
also, with maybe same-sex, if it's 2 females, there could also be the endometriosis there, or issues with ovaries. And again, it's then the decision of how to
Who will carry
combat
the
that.
baby? Yeah, we advise
Yeah.
them who is the healthiest to carry the baby. Obviously, the idea is to improve the chance of pregnancy continue and to achieving pregnancy as well.
Yeah. And I'm
Same thing.
sure for you, when you have that report back from the couples that there's a positive pregnancy test,
Oh yeah.
I'm sure you are smiling from
Not
ear
only
to
me,
ear.
the whole center
The whole
will be
team.
the whole team, the nurses, and my nurse usually, if it is a positive pregnancy, she will call me, Mr. Faraj is pregnant, blah blah blah. But if she's negative, she just send me the text by WhatsApp, and
Yeah, of
that's it.
course.
So,
But with the positive news and, carrying to full term, do you have then maybe you follow up with them and have
yes,
information about the new arrival? Is boy or girl
yeah.
and healthy?
Yeah, they actually they come by their will. I don't ask them to come. I love to see them, but they come. They're very grateful and
Oh, of course.
bring their baby with them, and or babies if they are
Baby,
twins.
yes, or babies.
So
Oh,
they come
amazing.
together. So it's yeah, it's very rewarding. As you said, yeah,
Yeah,
we enjoy seeing them again and again and again. And especially for
absolutely.
us now in the private sector, they always spread the word about our work, about quality of work, about our communication with our patients, which make a difference between unit to unit, really. That's why people
Absolutely. And I
they do
think
their homework and select the good unit. Yeah.
communication is absolutely key with anything in life, as we know, but
Yes.
especially when it's something like this, where, as we touched on before, the technical jargon can very much be over consuming and you just don't
Yeah.
understand. And that communication just shows that level of care and respect for your patients, is that you are there for them. You're
Yeah.
not just,
Absolutely.
when you arrive, you're not just the doctor that's going to help. You are, there to speak to them if they have any questions, any issues. And I love that you are, again, with technology, a WhatsApp voice note
Yes.
away or a message
Yes.
at any
Yes.
time. Or if they have, if, for example, they have their injections to do and they're a little bit confused or stuck, you're there at the end of the phone to help support that. It's amazing the work that you do, for sure.
Thank you. Appreciate that, Jesse. Obviously, even if you see social media, we have pages that are really professional pages for the Instagram, Facebook, and website, my personal website, all professional materials and backed up by scientific evidence, testimonials from patient. We try to do it in 2 languages. Even I
Yeah.
start to use the French language now, so Arabic,
Okay.
English, and French, because I have lots of people from Tunisia, Morocco, Algeria. They speak
Yeah.
French a lot.
Okay.
They're used to it. So I start to use, material in 3 or 4 languages really to cater for all these people. Remind me of my days back in hospital in Yorkshire and NHS. When I read the complaint, 90% of the complaint from patients about communication.
Yeah.
Nobody explained to them, nobody talked to them what was or handover of care or information from one healthcare professional to the other
Yes.
one.
Yeah.
There was something like a drop in the no zone, no area, and that will led to a communication problem and then substandard care.
Yeah.
So we know this fact. I was actually in September invited in National Qatar. They do a National Safety Week in
Okay.
September, the full week on patient safety and communication. It's a beautiful, fantastic event.
Amazing.
5 days a week, and I was invited to give a lecture. So many booths and presentations, and it's really very innovative. And talk about the importance of communication, health sector, and so many models on that. And now we're talking about AI introduction and
Yeah.
artificial intelligence. It make it easier, but I always believe it's not a replacement for the human touch.
Absolutely.
Is not a
It's
replacement for face to face. Not It's not an excuse to talk to her in person. When I see my patient come to me in first consultation, I remember she told me that patient who had a baby recently told me the only thing reassured me, Dr. Faraj, when I came to enter your office, is you looked me in the eyes and you told me you will be a mother. So, because I personally, I said this because I know she is middle age, say
Yeah.
35, 36. She has normal egg reserve. Her hormones are okay. Her ovaries are beautiful. I know she did 2 failed IVFs outside, but when I saw her, I thought this is a success story for me, a success case. So why I don't say this to the patient? Why I don't tell her you are a success for us and success for you, obviously? And she carried on. She conceived and she had her baby. She said that was a life-changing sentence you told me on that day. So
Absolutely.
these things are really important. I hope everybody will pay attention to them.
Definitely. Well, thank you so much for talking with
Thank
me
you
today.
too.
And it's
Yeah.
just been absolutely great to speak to you and those insights of
Yeah.
working in different countries and the support and the care that you really give with that. I will share all of his information when
Please do, yeah.
on our Facebook page and Instagram page, as well as the website as well. So we will share his information if you want to get in touch. That would be amazing.
Excellent.
But
excellent.
thank you so much for your
It's my
time
pleasure
today.
with you, Jessie, today.
It's
Thank
been
you.
amazing to speak with you.